The term infarction has its roots in the Latin word infarctus, meaning stuffed into. This aptly describes the condition where blood supply is blocked, leading to tissue death. In the early 20th century, studies began to identify the relationship between blocked arteries and heart attacks. This pivotal discovery laid the groundwork for the classification of various types of infarction. As medical imaging techniques improved, the ability to diagnose infarctions in different organs became more precise. These discoveries have been instrumental in shaping modern approaches to managing infarctions, significantly reducing mortality rates. The historical perspective on infarction underscores the importance of continuous research and innovation in the medical field. Infarction can occur in different parts of the body, each with distinct characteristics and implications. Myocardial infarction, commonly known as a heart attack, is perhaps the most well-known type. It occurs when blood flow to a part of the heart is blocked, often by a clot in a coronary artery. Pulmonary infarction affects the lungs and is generally caused by a blockage in the pulmonary arteries. This type of infarction is often the result of a pulmonary embolism, where a blood clot travels from another part of the body to the lungs. Cerebral infarction, or stroke, happens when there's an obstruction in the blood vessels supplying the brain. This interruption of blood flow can lead to the death of brain cells, resulting in permanent neurological damage if not treated swiftly. Splenic infarction is a less common but serious condition, where the spleen loses its blood supply, often due to an embolism or local thrombosis. Each type of infarction presents with its own set of symptoms and underlying causes. Myocardial infarction typically manifests as chest pain, shortness of breath, and sometimes pain radiating to the arm or jaw. Pulmonary infarction symptoms include sudden chest pain, coughing, sometimes with blood, and difficulty breathing. Cerebral infarction or stroke can result in sudden weakness or numbness, especially on one side of the body, confusion, trouble speaking, or loss of balance. Splenic infarction symptoms may be subtler, often including pain in the upper left abdomen, fever, and a general sense of malaise. Timely recognition of these symptoms and understanding the causes are crucial for preventing long-term damage. Awareness campaigns and education can help individuals identify potential signs of infarction and seek prompt medical attention. Section 4. Effects on the human body. The effects of infarction on the human body can be severe and, in some cases, life-threatening. Myocardial infarction can lead to heart failure, arrhythmias, or even cardiac arrest if not treated quickly. In the case of pulmonary infarction, the lungs can suffer from reduced oxygen exchange, impacting overall respiratory function. Cerebral infarction can have profound impacts on the brain, leading to cognitive deficits, paralysis, or speech difficulties. Rehabilitation may be required to regain lost functions and adapt to any permanent changes. Splenic infarction, while rare, can compromise the immune functions of the spleen, making the body more susceptible to infections. The systemic effects of infarction highlight the importance of early detection and comprehensive treatment strategies to mitigate long-term damage. Section 5 are treatments and drug classes. The management of infarction involves a combination of medical interventions and pharmaceutical therapies. Thrombolytic drugs are often used in the acute phase to dissolve blood clots and restore blood flow. Anticoagulant medications like Warfarin and Heparin are employed to prevent the formation of new clots. Vasodilators are another class of drugs used in managing infarction. They work by dilating blood vessels, thereby improving blood flow and reducing the workload on the heart. Beta blockers, such as Metoprolol, are prescribed to manage heart rate and reduce blood pressure, decreasing the heart's oxygen demand. Understanding the various treatment options and their mechanisms of action is essential for healthcare providers and patients alike, ensuring optimal outcomes and improved quality of life for those affected by infarction.